When we look at the opportunities in front of us in digital, healthcare is by far leading the charge. And we have three, I would say, innovative and innovator type personalities, Cal, Chuck, and Shailesh. The three of them have been driving this change at the forefront, but from completely different angles. And as the introduction stated, Cal is really looking at this from a technology standpoint, Chuck from a services and also from an educational standpoint, and Shailesh as well, and he's got as well a technical perspective. So I'm going to let each one of them introduce their points of view. That'll last for approximately 2 minutes each, and then we're going to go into an open discussion. Cal, why don't we start with you?
Sure, thanks. Thanks for the opportunity. Happy to do that. So, I come from a company now called Flex. We're about a 200,000 person global electronics manufacturing company that designs and manufactures electronic equipment, and we see a massive opportunity in healthcare and in digital health particular. And as we've been assessing what really is some of the challenges around why hasn't the technology revolution transformed healthcare to the extent that it should? And as you referenced, the opportunity is boundless here, and we all know the macro figures, both from a cost perspective and a care quality perspective that we can address. We see a couple things, so let me maybe just highlight one or two of them quickly. One is, I think, so much of technology in the first phase of kind of digital health has been around how do you get the fundamental core technology to work? So how do you take a Holter monitor that might have been all these wires and weight and cables and so forth and turn it into a sensor that you can wear? Or how do you take something else that used to be, had you tethered to the hospital for a month and now just get it into something that you can leave the hospital with or your clinician's office with, wear it and go home with, right? So it's fundamentally just getting that core technology to work. We're just hitting the phase where some companies are figuring out that, hey, I've gotten the technology to work, now it's generating this data. And then people stop and scratch their head and say, well, so what? In the history of humanity, we've never had continuous heart rate monitoring. Most of us in Western societies maybe get it measured twice a year when you visit your doctor, maybe one other place. Now you have continuous heart rate data coming. Well, what's the so what of that? Well, there is no so what unless you focus now on investing on the analytics, analytical capabilities to turn that raw data into insight. And that's the step that I think we're just beginning to come to really start putting sufficient focus on to say we're figuring out how to generate this new raw data set, but we need to figure out how to contextualize it and turn it into real insight. And then of course the next step is going to be insight in itself is not valuable if you can't turn that insight into changing a decision. So how do you get somebody to do something different, whether that decision is a provider, as in a physician or a nurse, or whether that is a patient or a consumer who's about to make a decision about a lifestyle or some other element. But you got to get that whole three-step process to work, and in healthcare we rarely see that all linked together from a digital or technology perspective.
Shailesh.
Sure, thanks. Let me start by giving some background about McKesson. I'm sure many of you have heard about McKesson, but those who haven't, we are the largest distributor of pharmaceuticals across the globe. We operate predominantly in the United States, Canada, but also in 20 other countries in Europe. 1/3 of all the prescriptions that are delivered every day, prescription drugs, are actually delivered by McKesson. So when you walk in a CVS or a Rite Aid, and if you're buying 3 prescriptions, then be sure one of it was delivered by McKesson. Being a wholesale distributor, that's not the only area that we operate. We also are one of the major retailer. In the US, we operate through a franchisee model. We have a Health Mart brand in the United States. In Canada and in Europe, we have our own stores. Just in the US, we are the 4th largest retailer. So one is being a wholesale distributor, second is being a retailer. Other than pharmaceuticals, we also deal in pharmaceutical equipments, medical equipments, and surgical equipments. So there are many facets of McKesson business. And how does that relates to data and analytics? I mean, if you look at the scale of McKesson, like I said, 1/3 of drugs, what that translates is we work on millions of orders and line items every day. And as you can imagine, the scale of our operations, we clocked 189 billion last year. Our last quarter was $50 billion. So the scale that we operate is pretty huge. And that translates into a huge amount of data. And it also gives us an opportunity, being the business that we in, or being the position that we are in, we get a 360-degree view of the entire healthcare ecosystem. We work with the manufacturers, we work with the payers, we work with the pharmacies, and we also work with the providers. So that gives us a very unique, kind of a role and getting a 360-degree view of the entire healthcare ecosystem. And that also drives a lot of analytics that we do. And we will talk as we go along,
Yeah.
but that's a kind of a business that we operate, and we are doing a lot to convert McKesson. So my role in McKesson is that of data and analytics, but it is primarily about how do we help our business to really drive insights on the tremendous amount of data that we are generating through all these operations.
We had an opportunity to talk, and of course, this subject of data analytics was a big part of our preparation for discussion today. And Shailesh said very, very openly, he says, "Well, I don't know if you all have heard of McKesson, but we're a company that's focused in this area." And we said, "No, we've all heard of McKesson, so welcome."
Yeah, I mean, we operate in the background, so many times, people do ask me that, okay, McKesson, McKinsey, where you work? So I always ask that question.
So, Chuck, I appreciate your insight and introduction as well, please.
Sure. Chuck Podesta, CIO, UC Irvine Health. UC Irvine Health is one of the 5 academic medical centers within the University of California system. And we also have a large medical school and research, which I'm over as well from a technology perspective, besides just the medical center. Kevin, you mentioned earlier in your opening remarks about the person who's going to live to 120 has already been born. And a lot of that will have to do with precision medicine around that individual and potentially curing a lot of the diseases that we can't cure today, or at least manage them to get that individual to 120. But also, that individual, most likely 60% of their body parts will not be original by the time they get to 120 as well. So that's another component of the technology when you think about it, and going forward, with 3D printing and things like that are starting to make its way into healthcare. Over the last 10 years, electronic health records, which you've all heard of, that's been kind of prevalent, throughout the United States, whether it's a physician practice or a medical center like UC Irvine Health. But we're starting to get beyond that now and moving into the data analytics phase of this. And some of this is based on how we get paid. We're moving from the fee-for-service to value-based care, and we need to create a better patient experience because part of our reimbursement is based on that, along with quality and certainly cost. So those 3 components come together to drive our bottom lines now, and we can't do it. The electronic health record, it's transaction-based, it deals with taking care of one patient at a time. It's really not going to get us to the point where we understand our business. So we actually have a very large Hadoop data warehouse that we've built over quite a few years. We've got a lot of information going into that, including all of our physiological monitor data. We have all that data dumping into Hadoop every minute of the day. And I'll talk a little bit more about what we're doing with some of that stuff as we move forward. But when you talk about the digital twins that you talked about earlier in healthcare, we're looking at what we call patient persona. So we're trying to, anytime you come into the UC system, ambulatory, ED, inpatient, whatever it is, we want to know who you are. So we want to create an experience for you that matches what your preferences are as we go forward. And you see that in the hotel industry now, and a lot of other industries are moving in that direction. Healthcare is as well, because that patient experience is just as important as the care that you get.
So let's talk a little bit about smart technologies, and I think this is something that is particularly of interest to me, because one of the things that you mentioned, Chuck, was that 60% of our bodies may not be authentic by the time we die in the next generation of sort of human existence. So what are smart technologies going to play to that? Part of it is, of course, monitoring devices, which I think is one segment of the technology, which might be checking our heart rate or checking our blood makeup or whatnot. But there's another element of it, which is really the prosthetic type of technology, or even the Genome Project and what's happening with the development of artificial organs or 3D printing them. So maybe, Cal, I'll start with you, and you can give your perspective as, what's the rapid pace of the development of these technologies, and do you really view them as two separate type of technologies? Do they merge?
Yeah, and I think one of the fundamental challenges with healthcare is, given that, again, you're working with humans and it's not an experiment, is a very personal and human element, that progress often does happen at the level of specific modules. So you will see, I think, all the things that you mentioned, they'll happen in discrete buckets, but the long-term value, in order to really unleash that, is you got to be able to integrate those. And we see models, I think, in other industries of that happening. And I think an interesting parallel for us to all follow here, at the Porsche Design Center is the driverless cars, right? And I think in many ways people have been talking about digital health much longer than they've been talking about driverless cars, and yet we're going to probably have.
I experienced a driverless car on my way over here today, this morning. So.
So I think you see that, that's another very complex ecosystem that's going to transform way faster than we're going to see it on the biomedical side, because of the very nature of both the complexity, but also everything from a regulatory and ethics, et cetera, perspective. So I think you'll see substantial progress happen in discrete buckets, but then the real value will be unleashed when you can start linking a lot of this stuff together, right? And said another way, we hear about stuff in the press that something has been done, but then the lag time between that and commercialization of that is decades often, and I think that's one of the fundamental just things to keep in mind when we think about the pace of change.
So Chuck, I'm going to jump to you real quick, because I think you're seeing it in real medicine, right? And you're getting demands as a CIO to be able to support these technologies in your environment. So that's a flip side of it, and then we're going to move to Shailesh and actually talk a little bit about what they're developing.
All right, well, the flip side of it is just managing all those various devices. They're all network-based, so you have the security issues, and especially in healthcare, that's a big deal these days. So that's a big component right now. But we are, when you think about the sensors that people wear, the interaction with their providers on a real-time basis, if you think about how Amazon works with suggestions, it's all suggestion-based as you're, going through that website. This will be similar, based on your eating habits, based on, what particular, maybe you have diabetes and what particular disease you're fighting, and that constant interaction will suggest things as you go throughout your day, even to the point where, it's time to go actually see the doctor, and that's probably going to be through a telehealth, video screen. With facial recognition, we can tell now how much pain you're in without you even expressing it. There's also some really cool science out there around people who are depressed, even though they say they're not depressed. You can do that through facial recognition. Also, there's some apps coming out where you can actually tell where the patient is heading towards, wanting or thinking about or heading towards wanting to commit suicide. So these types of things you can intervene in as you go, but managing that infrastructure, you can imagine, because now you're not within the four walls of the hospital anymore. You're out into the home and out into the community, and these are all network-based into your systems. And you're constantly grabbing that data in a real-time fashion. So from a standpoint of a data warehouse, cloud-based computing, being able to capture that data and be able to scale the storage that you need is quite daunting as well.
So Shailesh, what's the pace of this? How quickly is this happening?
Well, I'm going to take a step back actually, and on one hand, what we just heard from Carl and Charles. On the other hand, if you look at healthcare, the delivery of basic healthcare services, right, that itself is undergoing change. And I would like to cite an example of McKesson venture. So we also have a strategic venture fund. And we have recently invested in one of the startups called PokeDoc. I don't know again how many of you have heard about this, but I think Charles mentioned about how do we provide an Amazon-like interface to our to the patients, so that you can, I mean, think of you, me, all of us as services who take basic medical services. We still don't have the mechanism of going and looking out, identifying what service you need. Like if you want to take a flu shot, what are the comparative prices for it, where it is available, and go and compare it. So this organization or this startup that we are working with is actually using blockchain technology to really create this whole virtual marketplace and it can be as simple as a flu shot, or it can be as complex as a shoulder replacement. But they are offering this one unique virtual platform, and we being, again, like I'll go back to what I said earlier, being at the center of the ecosystem, we are able to leverage that knowledge and work with a startup like this. And this is a completely different than what you were asking, but this is about delivering efficiently the basic healthcare services to all the consumers, including all of us.
So when we talk about delivery of service, and particularly the delivery of healthcare as it pertains to patients, the big problem is waste, right? In most of the circumstances that we've encountered at Avasant is circumstances where there is overtreatment, or there is poor diagnosis, insufficient investment in preventative opportunities. And so data and analytics can obviously help with this, and we talked considerably about this when we met for the first time. And so I'd like to understand from you, how will the course of medicine and treatment change with the types of analytics that we're developing? So, and how quickly will we see it, and what areas will we see it? So, Cal, I can have you start.
Sure. I think, I would hope this is a question that was being more wrestled with today as we talk about, potentially repealing ACA and replacing that with a new type of healthcare reform. And I think there's a real missed opportunity overall that in the context of healthcare reform, we don't explicitly think about and debate and introduce ideas to generate the use of technology to achieve those goals of better clinical outcomes and lower cost. And I think that's the starting point, is that framework that's set up by the government. And then the reason why that framework matters so much is it's not about the regulatory side, but it's about what Charles was saying earlier. It's about how you get paid. And fundamentally, we need a system where the incentives of the system are for all the actors to, when I say actors here, provider, health system, payer, patient, caregivers, et cetera, that all their incentives are actually aligned towards achieving an outcome that's around the best clinical outcome, at the best, most efficient way to achieve that. And today, that's fundamentally misaligned, and though we're shifting towards value-based care, that's moving us in the right direction. And in some ways you can say we're getting there really fast, in other ways we're getting there quite slow. So to try to answer your question more directly, I think those pockets of area where we see, and again, you'll be able to speak to this, Charles, with more specifics, but areas where we see either the right value-based or capitated system where those incentives are coming together, that's where I think you'll have adoption of technology and a real push to get the behavior changes. Again, that behavior change could be at the level of a physician, or the behavior change is at the level of the patient, or somewhere in between, where you'll get those changes to happen in order to, again, incorporate technology and get us to a better place from both a clinical outcome and a cost perspective.
Chuck?
Yeah, I think where the analytics really needs to go beyond the medical science is the behavioral side. Because if we can't change the behavior of an individual, it doesn't matter how much information that we give them, how we take care of them, right? And I'll give you a couple quick examples. One is personal for me. 5 years ago, I started long distance running, based on, just a change I wanted to make based on something that happened to me. And now I've done 8 marathons, and I'll be doing the Boston Marathon in the spring. And this is 5 years later. I've completely changed. All the drugs I was on, from Lipitor, now I take a baby aspirin every day, and that's basically it. So, and I'm 59 years old. So that happened personally to me. If you look at another example, I use Bill Clinton. If you remember when Chelsea got married, he lost all this weight. You know, he looked great at the wedding, but 6 months later, he had still kept the weight off, and people were like, wow, you know, expected him to gain it after the wedding. Well, his answer was, I didn't lose the weight for the wedding. I lost it because I want to see my grandkids. So that's the heart of that's what we got to get to people. We got to figure out what is the motivation that will change their lives, whether they're a diabetic that's overweight, to be able to lose that weight, you know, not stop at a McDonald's on the way home, you know, that type of, all the science that we have will go for naught if that individual, we can't change that individual's behavior and find out where that trigger is in the individual. And that, to me, is what's exciting about the analytics, because when we can get to that, then we can change personal behavior to the point where now people can start taking care of themselves.
So Chuck, we have a lot of agreement on this panel, and agreement is great, but this is one of the most controversial issues that faces us today, and yet it seems like healthcare professionals and technologists are in agreement. How does that, and I'll move this one to you, Shailesh. I probably wanted to answer that one, but I'm not going to let you. What we're going to answer instead is, how are we going to change the perception of what seems so obvious to all of you? And how are we going to drive that what is so obvious in terms of investing in data, investing in analytics to drive preventative medicine, to drive new technologies? And what's the timeline for that, Shailesh?
Sure. And I think we believe that somebody like McKesson has a pretty important role, again, to play in this, using data and analytics, because when you are working with different types of providers, right, it can be a small doctor's offices, hospital chains, to large providers. I think providing, not everybody is able to really utilize all the tools and the data and analytics that is on offer today. And that's where we are playing a big role there in terms of helping, because there's a lot of information that we are gathering, and how do we enable our customers, which is basically the providers, to utilize that information in furthering this cause of giving preventive medicine. So that's the kind of a role we, as again in the center of the ecosystem, are trying to play in this whole thing.
So I'm gonna change gears a little bit here, and Chuck got ahead of it a little bit on the medical records piece and the digital twins. You know, the concept of health records management, right, is one that we've dreamed of, that the Healthcare Act has envisioned as well, along with alignment with HIPAA, to create a regulatory platform that really allows us tremendous opportunity to drive unified medical records. So where are we at? I mean, from both a technological perspective and also from the perspective of actual application at the university. And how is that going to work across multiple systems? And is that something that you're investigating?
It is, but you know, I think, and maybe this will get controversial here, is I think the day the electronic health record...
Controversy is good, let's have some.
Yeah, I think the day the electronic health record over the next 10 years is going to start to wane. Right now, it's not open source. You've got a couple of big behemoths that own, you know, 90% of the market, and they don't talk to each other very well. And there's no desire for them to talk to each other well. Each one is trying to take over the world and get all of healthcare onto their particular product. But when you look at how that works, and you look at where analytics is going in the Internet of Things and sensors, these systems are not built to ingest that data. And so, and the EHR is actually one just source data point for analytics. So I see it being an important part where you'll feed information back into it from the point of care perspective. But when you talk about the caring for the entire patient, I don't think the electronic health record, I think that's going to fall behind. There'll be a wrapper around it in some way that's analytics-based, you know, web-based, you know, that will actually be in a real-time kind of predictive analytics type of format. Now, I'll give you one quick example. We have a product called Code Blue that we've developed along with a startup company on our analytics. We take all the physiological monitoring information for the last 4 years. We got all the lab data, everything else on the patient. So we started looking at patients that had crashed, Code Blue. And we looked at what happened to them 30 minutes before the crash, an hour before, the day before. And we created actually some algorithms around that where we can actually predict now, in certain instances, fairly high degree that a patient is actually going to crash. Most of this is in the ICU, maybe in the ED as well.
Amazing.
So we fired that up 4 months ago, and we documented 2 patients that we saved from crashing. Now, you can save a patient after a crash as well, but typically a lot of damage is done in that particular instance. So we went back to the electronic health record, and we took the physicians, we had them look at the EHR and say, okay, would you have done anything different by looking at what was going on in the EHR with these 2 patients? And they said, absolutely not. Because the analytics was much more real time with the monitoring information coming in on 1-minute intervals. The EHR was not as fast with that information. And when you're 30 minutes from a crash, you need that real-time analytics. And to me, that's where the EHRs are going to start to fall short, and where the analytics side will pick up.
Yeah.
That's my view.
So Cal, this is going to be the last question for you, and then we're going to open up to audience questions. Please.
Yeah, just to build on that, if you think about what the EHR typically is capturing, it's capturing the output. It's capturing the outcome. Your cholesterol is X. That's an outcome of a whole lot of decisions that are being made every day of your life for multiple days. The input part is not captured that at all. And to the Chuck's previous point, that's where the behavior change happens. So the fact that we can definitely get efficiencies by not repeating tests and doing a bunch of stuff that is captured and stored in EHRs. But if you want to really drive that change, you got to find a system to be capturing what are the decisions that people are making when they're not in the hospital, when they're not in the clinic. And I think the EMR companies are recognizing that both the importance of those decisions, the ability to track those decisions, and the movement of healthcare out of expensive facilities like hospitals and clinics and into your home and kind of non-medical life, that's where the future important data is going to come, and where the data and analytics and insight generation and behavior change is going to have to happen. So either they're going to have to pivot and figure out a way to be relevant in that space, or I think to your point, over time, they're going to become less and less relevant in the way we think of them today.
Thank you.